Hello friends, welcome back to Complete Medical Coding. Today let's discuss a few practice questions from eye and ear. Okay, eye and ear. This session falls under 60,000 series. Okay, so let's discuss those practice questions. And few questions have already came on last year, 2024 CPC examination also. So let's look into the questions. So before that, friends, if you are new to the channel, please subscribe and let's move to the questions one by one. What is the first question? First question. An infant born at 33 weeks underwent 5 photocoagulation treatments to both eyes due to retinopathy of prematurity at 6 months of age. The physician used an operating microscope during these procedures. These treatments occurred once per day for a defined treatment period of 5 days. How would you report all of these services? So here the infant was born at 33 weeks. So it means that baby is a prematured baby, right? So that infant undergone 5 photocoagulation treatments to both the eyes. Both the eyes, 5 photocoagulation treatments. Due to retinopathy, because he was having retinopathy at 6 months of age. Okay. So how did the procedure carried out? The physician used an operating microscope. Okay, that's not required. Now, these treatments occurred per day for a defined treatment period of 5 days. So per day, 5 days. Up to 5 days, these treatments had been carried out. 5 photocoagulation treatments. Okay. Anyway, let's find out the answer. Let's find out the correct CPT code. What is the first one? 67229. See, if you can check in all the options, it is the same CPT code. 67229. So go to 67229. What is 67229? Treatment of extensive or progressive retinopathy, 1 or more sessions. Yes, we have 5 sessions. 5 photocoagulation treatments. So it means 5 sessions. Preterm infant, less than 37 weeks gestation at birth. Yes, this is preterm, 33 weeks. Performed from birth up to 1 year of age. Yes, this service is carried out at 6 months of age. Example, retinopathy of prematurity. Yes, this is retinopathy, right? Retinopathy of prematurity. Photocoagulation or cryotherapy. Yes, this is photocoagulation treatment. Sorry. Yeah. So this is the correct CPT code. Anyway, this is the same code which is mentioned in all the options. Sorry. Okay. So now if you can check in option A, 50 modifier is used. Option B, same CPT code times 5. Option C, another option 69990, that is for operating microscope. Okay, because in the question it is mentioned physician has used an operating microscope. And then option D, just simply that code. So from this you have to find out what it is. So first one 67229 modifier 50. If you check the code 67229, below it's mentioned for bilateral use, for bilateral procedure use modifier 50. Okay, with 6720, it's all these codes. In that our code is also mentioned 67229. So since this is bilateral, you have to use modifier 50. Now in option B it is mentioned times 5 because of 5 treatments. But no, in the description itself it is mentioned 1 or more sessions. So it can be more. So you should not put 5. Okay. Now option C 69990. What is 69990? That is the code for operating microscope. But go and check. There are few codes which should not be used along with 69990. So check if our code is present there or not. See, if you go to 69990, see, do not report 69990 in addition to procedures where use of the operating microscope is an inclusive component. In that, check if 67229 is present or not. Yes, it is present. 67229 is present. See, that range is mentioned, 65091 to 68850. So it means 67229 is also present in that operating microscope code is present in that 67229 code. So no need to mention it separately. So since this is a bilateral and you have to mark it with modifier 50, so the correct answer here is option A, 67229 with modifier 50. Okay. Now moving to the second question. A patient had a cataract removed 70 days ago on the right eye. The ophthalmologist finds opacification and incises the posterior capsule with a YAG laser. Which code should be reported? So here cataract removal is the procedure on the right eye. Okay. Let's go to the codes directly. 66985. First code. First option 66985. Yeah, what is CPT code 66985? Insertion of intraocular lens prosthesis not associated with concurrent cataract removal. In our question, there is nothing mentioned of insertion of intraocular lens. It's not mentioned, right? So that's a wrong code. Now go to option B, 66821. What is 66821? 66821 is decision of secondary membranous cataract, opacified posterior lens capsule, stab incision technique. Yes, this is incision technique because it's mentioned in the question. The ophthalmologist finds an opacification and incises the posterior capsule. Okay. So opacification, posterior capsule, all these are mentioned in the CPT code 66821. Okay. In the stab incision, this is not stab incision technique. 66821 is the same decision of secondary membranous cataract, laser surgery, YAG laser. Sorry, I'm wrong. Yeah, YAG laser. Okay. Incision is there, but this is not stab incision. Stab incision code is 66820. In our option, it is 66821, which is YAG laser. Yes, so that is the correct CPT code, 66821. So what is 66821? 66821 is, this is what we need, the CPT code. Okay. Decision of secondary membranous cataract, laser surgery, like YAG laser. Okay. Anyway, this is under incision session only. So 66821. Anyway, let's check the other codes as well. What is option C? 66982. 66982 is extracapsular cataract removal with insertion of intraocular lens prosthesis. No, it's wrong. And what is it? 66984? Again, extracapsular cataract removal with insertion of intraocular lens prosthesis. That's also wrong. So here the correct answer is, the correct CPT code is 66821. Okay. Why is it appended with modifier 78 and RT? RT modifier because it is on the right eye. So you have to append with RT. Why 78? What is modifier 78? Modifier 78 is unplanned return to the operating room or procedure room by the same physician following an initial procedure. Same physician, okay. Unplanned return to the operating room for the same procedure, for the initial procedure, because here it is mentioned cataract was removed 70 days ago. So the cataract removal was done 70 days ago on the right eye, and then but the physician, the ophthalmologist, finds opacification, so that he has done a posterior capsule. He has incised the posterior capsule with a YAG laser. So this is the return after 70 days, right? So you have to append with modifier 78. Okay, so here the correct answer is option B, 66821 with modifier 78 and modifier RT to represent the right eye. Okay. Now, third question. A 65-year-old patient presented with ectropion of the right lower eyelid. Repair with tarsal wedge excision is performed for correction. Attention was then directed to the left eye. The patient also had an ectropion of the left lower lid, which was repaired by suture repair. Code this procedure. So here ectropion. Do you know what is ectropion and entropion? I had already mentioned this in previous videos in the anatomy as well as in the 60,000 series chapter. Ectropion and entropion. Okay. So ectropion. So here the ectropion procedure is carried out. Right. So here the ectropion is carried out. Okay. What you have to mark here? Here ectropion is carried out on the right lower eyelid. And then repair is done here, right? Repair with tarsal wedge excision is performed. Repair with tarsal wedge excision. So let's find out the answer for what is that? Wedge excision, the repair of wedge excision. That's what we will have to find it out. Okay, let's go to the options. The first one, 67916. What is 67916? Go to CPT code book and take 67916. 67916 is repair of ectropion excision tarsal wedge. Yes, this is the CPT code that we need. This is repair of ectropion excision tarsal wedge. Yes, this is tarsal wedge excision. Same as mentioned. What is ectropion? Ectropion means outward turning of the eyelid, and entropion is inward turning of the eyelid. So here ectropion is carried out. So this is the correct CPT code that we need, 67916. Now go to other options. Again 67916 is present in option B. 67916 is there. And what is 67914? In option B, what is 67914? Repair of ectropion suture. Is there any suture carried out here? Yes, the patient also had an ectropion of the left lower eyelid which was repaired by suture. So it means this is another procedure. The patient also had the ectropion of the suture of the ectropion of the lower lid. So that also you have to code. And why it is mentioned with modifier E2 in 67914? Why E2 67914? Because suture it is carried out on left lower lid. And the codes and the CPT code 67916 with modifier E4. E4 represents right lower eyelid because ectropion of right lower eyelid is carried out with tarsal wedge excision. So both are different eyelids. It's not the same. So you have to mark it with modifier E4 for the first procedure and then E2 for the second procedure, suture procedure. Okay. If you see option C, it's only one code present 67914 and it has marked with modifier 50 to make it as a bilateral. You cannot mark it as a bilateral because also anyway it is right lower eyelid and left lower eyelid, but there are specific modifiers that mark the accuracy of the CPT code. So you have to mark it with that modifiers. Okay. For eyelids, there are modifiers E1, E2, E3, E4. So accordingly, you have to mark it. Similarly, option D is also wrong, 67923. If you want, you can check what is 67923 and 67921. 67921 and 923. This is entropion. Okay, so that is wrong. So anyway, as mentioned, you got the correct answer as option B, 67916. Okay, 67916 with modifier E4 to represent the repair of ectropion excision, tarsal wedge excision, and then with modifier, appended with modifier E4 for right lower eyelid, and then 67914 repair of ectropion suture, mark it with modifier E2 for left lower eyelid. Sorry, E4 is right lower eyelid and then E2 is left lower eyelid. Okay. So this is how you need to code. Okay. All right. Now let's go to fourth question. What is fourth question? A 4-year-old with chronic otitis media and fluid buildup in both ears was admitted by her otolaryngologist for a bilateral tympanostomy. The procedure was performed with placement of ventilating tubes. The procedure required general anesthetic due to the patient's age because it's 4-year-old, right? Now, select the procedure code for this procedure. Here you have to find the CPT code for tympanostomy. Tympanostomy is the procedure carried out here. Anyway, moving directly to the CPT codes. What's the first one? 69420. Go to 69420. 69420 is myringotomy procedure. Myringotomy including aspiration. No, it's wrong. 69421. Again, myringotomy. That's also wrong. What is option C? 69433. 69433 is tympanostomy. Yes, our procedure carried out here is tympanostomy. So, what is 69433 option C? Tympanostomy requiring insertion of ventilating tube, local or topical anesthesia. This is requiring ventilating tube, insertion of ventilating tube. And what is option D? 69436? 69436, again tympanostomy requiring insertion of ventilating tube. Yes, because it's mentioned in the question, with placement of ventilating tubes, general anesthesia. So the codes 69433 and 69436 both are for tympanostomy, but 69433 is only local anesthesia, but 69436 is general anesthesia because the patient is 4-year-old and it is mentioned general anesthesia. So the correct answer is option D, 69436, tympanostomy with insertion of ventilating tube, general anesthesia. And down it's mentioned for bilateral procedure, you have to report it with modifier 50. Yes, this is a bilateral procedure. Both ears is mentioned. So you have to append it with the modifier 50, which makes the answer as option D. Okay. Now let's look into one more question. Fifth question. This is actually a case study. Okay. You will get it such type of questions in case study. What codes would be reported for the following case? Pre-operative diagnosis, bilateral impacted ventilating tube. Post-operative diagnosis, same, which means bilateral impacted ventilating tube. Anesthesia, general. General anesthesia is carried out here. Procedure performed. What is the procedure performed here? Removal and replacement of new tubes bilaterally via tympanostomy. See, again, almost the same procedure as in fourth question. Okay, but slightly different. Yeah, bilateral tympanostomy procedure. What is the procedure carried out here? I mean, how the procedure is carried out. Sam, a 16-year-old patient, was admitted and taken to the operative suite and placed under general anesthesia by inhalation. When adequate sedation was achieved, a 3.8 mm speculum was inserted into the left ear, wax removed and speculum removed. The impacted tube was then removed. A new site was achieved within the same tympanosclerotic plaque and a new tube placed. The same procedure was repeated to the right ear. Sam was sent to the recovery suite in stable condition. See, this is almost a similar question when you compare to the fourth question. So such type of questions can be, you will get questions. You may get questions directly as in fourth question. You might get questions like this in fifth question. So this question, if you can see, it looks little big. If you compare to other questions, you might feel that, oh my god, this is a big question. But no, when you understand that concept, see, that's why I had put both the questions together to make you understand how a question or how many ways a question can be asked. Okay. Fourth question was easy, right? Now let's see what is the fifth question. Fifth question is also, now you have already done with fourth question, so you will be knowing easily the fifth question. You are able to understand the fifth question. So what is it? Bilateral impacted ventilating tube. Yeah, which means it's written there, right? The diagnosis, pre-operative diagnosis and post-operative diagnosis are the same. Bilateral impacted ventilating tube. And what is the post-operative diagnosis? Again the same. Bilateral impacted ventilating tube. Okay. So let's move to the question, the options. Here also the same procedure was carried out, tympanostomy. Initially, it was carried out to Sam on the left ear, the wax removed, and then same procedure has been carried out on the right ear. Okay. Anyway, moving directly to the options. What is the first CPT code? See, if you can check the ICD code, it's 61.23. It's the same ICD code in all the four options. It's 61.23. Okay, I'll come back to that later. Okay, let's first find out which is the correct CPT code. 69424. What is 69424? 69424 is ventilating tube removal requiring general anesthesia. This is not ventilating tube removal, but this is tympanostomy. Okay, so that is the wrong option. What is option B? 69433. Again, tympanostomy, same as mentioned in the previous question. Tympanostomy requiring insertion of ventilating tube, local anesthesia. Is this what anesthesia is carried out here? It is general here. So that is also wrong. So what is the code for general anesthesia? 69436. Yes, as in option C, 69436. Okay. And if you go to option D again, 69424 code, which is wrong. So let's wind it up in option C, 69436 with the modifier 50. Tympanostomy requiring insertion of ventilating tube, general anesthesia. This is exactly the same procedure which is carried out here, but they had mentioned all how the procedure is carried out. Everything has been mentioned it like a history. Okay, it is in detail, it is mentioned. So don't be confused with that. So such type of questions can be asked in both ways. Simple question as in fourth question, or a complicated one. Not much complicated, but still. So the only thing is that you have to identify what exactly the procedure is carried out here. Okay. So 69436. Yeah, that is the CPT code that we need. Append it with a modifier 50 because the procedure is carried out in both the ears. Initially it was on the left ear. Then it is mentioned at the end of the question, the same procedure was repeated to the right ear. So it means it's bilateral. So that is the correct CPT code. Now what is ICD code at 61.23? That is again same. Bilateral impacted cerumen bilateral. Means both sides of the ear there is earwax. Okay, so impacted cerumen both bilateral. Yeah, both ears. So that is the ICD code at 61.23. So here the correct answer is option C. Okay, 69436 with modifier 50 and at 61.23 as the diagnosis. All right. So friends, that's all about today. These are few important questions. The way how the question is being asked in the CPC examination. Okay, you can just compare questions 4 and 5. So because I have put those questions to make you understand how to save time. Just read the question properly, understand it thoroughly, then definitely you can find out the answer easily. Anyway, so thank you so much friends, and let's see you in the next episode. I'll be coming back again with few guidelines and more questions. Of course, practice questions as well. So thank you so much for all your support. If you have any queries, please mark it in the comments. Those who are new, please don't forget to subscribe my channel. Thank you so much and stay tuned. Bye. Take care.